Renal colic is an acute pain in the kidney that is caused by stones in the urinary tract. The urinary tract includes the kidneys, ureters, bladder, and the urethra. Stones can develop in any part of the urinary tract. These stones form when some kind of minerals like calcium and uric acid stick together and create hard crystals. Symptoms of renal colic vary depending on the size of the stone and its location in the urinary tract. It is estimated that 12% of men and 6% of women experience renal colic at some stage in their life, so it's a really common problem. Renal colic is just one of the symptoms of the urinary stones. There are other symptoms that can occur alongside renal colic. These symptoms include dysuria or painful urinating, hematuria or blood in the urine that may make it appear red, pink, or brown, urgency or feeling constant urgent need to urinate, nausea and vomiting, and smelly urine. Some of the symptoms alongside renal colic requires emergent evaluations. A fever higher than 101 degrees Fahrenheit, nausea or vomiting, and anuria or complete inability to urinate. If a patient has at least one of these symptoms, contact the emergency medical service to start symptom assessment as soon as possible. Many patients with renal colic can be managed conservatively until the stone passes, but in some cases this may not be enough, so invasive treatments might be needed. Small stones are passed spontaneously, and the patient only needs to drink enough water to stay hydrated and take analgesic medication to reduce the pain. Patients can be managed at home if they are able to drink fluids and take oral medications. Hospitalization is just for those who cannot tolerate oral intake, or those who have uncontrollable fever or pain. There are some different medications that are used to control pain in renal colic. Non-steroidal anti-inflammatory drugs, or NSAIDs, and opioids are the two main categories of medication used to relieve pain. NSAIDs are first-line treatment for pain because they have greater effect in pain reduction and have a longer duration of action in compared with opioids. Among NSAIDs, diclofenac is often the first choice for renal colic. It is available in oral, injectable, and suppository formulations. Sometimes diclofenac may not be the appropriate choice for patients. In this situation, we shall use other NSAIDs like ibuprofen and naproxen. And if the patient is unable to take oral medications, intravenous ketorolac can be used instead of diclofenac. Opioids are alternative to NSAIDs. Morphine is the most commonly prescribed opioid. Especially in pregnant women, it's preferred over NSAIDs. An antiemetic medication may be considered for the prevention of nausea and vomiting. Ondansetron and metoclopramide are approved antiemetic in the treatment of renal colic. Some studies have shown that ondansetron is more effective in improving vomiting in renal colic. Despite of all these medications, large stones may need other type of intervention to pass. Here are some common methods. The first one is Shockwave Lithotripsy. In this method, ultrasound is used to break large stone to smaller pieces and help it pass easier. Percutaneous nephrolithiasis, or PCNL, is a way that a long and thin device passes through the back into the kidney and break up or remove stone using laser energy. And another method is ureteroscopy. In this procedure, the doctor inserts a long thin tube through the urethra which connects the bladder and the kidney. Then the laser energy is used to break down the stones to smaller pieces.